Hello, my name is Ryan. We're going to go over how to perform a physical therapy evaluation. Mainly the bullet points, anything within the red boxes needs to be filled out, checked, added. First off, patient identity needs to be checked. Time in, time out needs to be at a minimum of 40 minutes. If that time needs to be greater, we would let you know. Diagnosis and history, we will be providing you with the medical diagnosis in the yellow sticky that is included with every patient. You will be creating your own physical therapy diagnosis. You will need to add history, prior level of function, patient goals and precautions. Homebound status is yes. Criteria 1, this is and or, so one of these two boxes needs to be checked, and you will need to elaborate on the reason for the patient's homebound status. And here are some examples below. Criteria 2 is and, so both these boxes need to be checked, and you will also need to elaborate as you did above. The social support and safety, all this information needs to be checked out. Please do not leave any of these blank. Vital signs, you need to definitely include at least one. We do encourage you to take some post vitals. If any of the vitals are out of the patient's norm ranges, below you can add, example here is MD notified of hypertension. Subjective information, pretty straightforward. You're going to add your subjective information here along with your COVID screening. Physical assessment, please do not leave any of these blank. If there are impairments, please add the reason for these impairments or the functional impact that these have on the patient. Edema, please address. Pain assessment, you need to include your pain assessment. If the patient does not have pain, you can check no pain. Most patients will have pain, so if they do, please elaborate. Increased by, relieved by, interferes with. Do not leave those blank. Physical assessment, please fill all of this out for the physical therapy, specifically the lower extremity and home health. If you choose to leave the upper extremity blank, that is fine, but please do assess all the patient's lower extremity range of motion and strength. Functional assessment, you will need to assess the patient's bed mobility, gait, transfers, wheelchair mobility. Within the factors contributing to functional impairment, if there are impairments, you do need to elaborate below in these boxes. Please address weight bearing status, balance. This is just checks and drop downs, pretty simple. You will need to include test and measures. This will take you into another page. It will auto save, but you need to add these as this is how we show measurable progress, which also gives us visit justification. You need to address patient's DME. Here is your assessment and your findings. You can create your own template, copy and paste, and then fill out from there, but it needs to be patient specific. We will go over how to establish the patient's goals at the bottom of this, but you will check this. This will also auto save everything you typed above, but it will allow you to create goals. Within your evaluation, you will need to add care coordination. If PTA is attached to the plan of care, you will type their name here. You will type PARS intake team. If you needed to coordinate with the nurse for any reason, you will type it here. Physician notified. If it's an evaluation, you will check this box. Statement of rehab potential, check. Treatment, completion of evaluation, check. Other, I usually include any treatment I did with the evaluation. I left the patient a home exercise program. I include that here. Frequency, here is your start date, your end date. So this patient was 2 week 8. As soon as you know your frequency, please do send the intake team a message of your frequency, be it text or K-mail. That way we can get the authorization process started. You'll need to select a discharge plan, and we go from there. The next step is selecting the goals. So when you first open that tab, the select your goals button above, it will take you to this. You will select new goal, okay, and it'll pull up here, and you'll type your goal here, and then you'll either choose long-term, short-term. So here, long-term, by the end of the episode, you'll add your goal. The next, you will add an intervention. Click this button, and here's a completed intervention. Once it's completed, you will want to perform that intervention. Clicking here, check, check, and then submit. And then with the evaluation and with subsequent treatment visits, you will want to document progress. It will pull down a list similar to this, and you can select improving, declining, unchanged, or you can give percentages. And that is pretty much it on how to perform a physical therapy evaluation. If you have any questions, please let us know.